What often makes it even more difficult is that at the typical age of onset of menopause, which varies, let's say, from 45 to 60, roughly speaking, typical dental issues naturally arise in dental life anyway. For example, the necessity of having implants. Welcome to the Biolong Charity Doc Podcast. Today we're talking about a topic that's often oversimplified in society, but is of enormous medical importance, and that is menopause. It's not primarily a cosmetic issue, as some might mistakenly see it, nor is it primarily a lifestyle phenomenon, and it's certainly not a state of deficiency. Menopause is therefore a profound endocrine, meaning hormonal, transition or transformation. In other words, a change with systemic effects on almost everything. The vascular system changes due to a change in endothelial function, and bone metabolism, meaning the bone remodeling processes that naturally occur in our organism, are profoundly affected. Brain function is also logically influenced in various ways. This involves neuromodulators, and of course it involves neurotransmitters. It's about immune function in general. The immune system is a highly complex system. This is naturally also significantly influenced by this hormonal change. It's about metabolic functions in general, so also how efficiently and how well a metabolism ultimately functions in metabolic terms and with regard to energy production. And indirectly, of course, it's always about long-term longevity. And that's exactly what we're talking about today, naturally with a special focus on my area of expertise, biological dentistry and integrative oral health, and what that has to do with it. But back to the beginning, what really happens hormonally during this transformation phase? With the transition into menopause, ovarian estrogen production drops significantly, as is well known. Especially estradiol falls very, very sharply. However, estrogen doesn't only act in the reproductive system. It significantly influences, for example, fundamental things like endothelial function, meaning the way the inner layers lining the vessels function, the inner cell layer, which is essential for metabolic exchange. And also many inflammatory mediators and many other factors that intervene in the function there can significantly influence the development of many other diseases indirectly and directly. This hormonal change naturally also very strongly influences lipid metabolism, meaning the lipid composition. How fat metabolism works in the whole system, how efficient or inefficient it is, and what changes occur here. This in turn is indirectly related to cardiovascular risk factors during menopause. In general, it's about bone metabolism, the remodeling or restructuring process that naturally occurs in the bone all the time. It's also about glucose metabolism or sugar metabolism, which of course significantly influences many other metabolic processes. It's about the neurotransmitter systems, meaning brain function and also mood. It's about inflammation regulation, a very important basic regulation. Countless studies, which we link here, provide a very good overview of these highly complex relationships. It's also important to note that there are, of course, extremely strong inter-individual differences in this entire transformation from patient to patient. This means that, as in other, let's call them transformation phases, there are also very large differences between individuals here. And what's true for one patient is by no means true for another. Nevertheless, general statistical frequencies can be summarized. And that's why this whole transformation naturally affects everyone differently in the oral cavity as well. With falling estrogen levels, which is consistent, the systemic inflammatory tendency increases in many women, and that is a very central longevity factor. What does that mean in turn for the oral cavity? Of course, gum inflammation or burning mouth syndrome or gingivitis or specific mucogingival mucosal irritations take a much stronger hold. Another factor comes into play that strongly supports periodontitis, namely the factor that at this age of menopause, which also varies individually, quite a bit has already accumulated dentally in the life history or dental treatment history, and so more multi-causal relationships come into play, so to speak. So keywords here would be, for example, gingivitis, periodontitis, Periimplantitis, these are very important clinical pictures that also occur very frequently. And then, of course, they are also strongly modulated by these hormonal changes during menopause, usually for the worse. That's why we're discussing it here. And that's why it's also important during menopause to bring dental conditions into a restored state in good time or in terms of care, to do the right things to be as less susceptible as possible to corresponding pathologies. Typically gingivitis, especially periodontitis, and thus also peri-implantitis, all of which are very common forms of dental or oral disease, are in themselves a high cardiovascular risk when considered on their own. But in menopause, a few more aggravating factors multiply and come into play, because you see, before menopause, women generally have a lower cardiovascular risk than men. After menopause, however, this risk increases negatively, meaning women then become just as susceptible to cardiovascular risks as men. The mechanisms are as follows, and they are fueled by this hormonal change, a deterioration of endothelial function. Now, good endothelial function is an important risk avoidance factor for any cardiovascular plaques and corresponding cardiovascular events like stroke, heart attack, and so on. And this also happens through a change in lipid metabolism. In menopause, or from menopause onwards, there tends to be an increase in LDL, especially oxidized LDL, which is again negative. There is a drop in HDL, so both are parameters that in themselves are negative. And above all, there is an increase in visceral fat storage, so the fat distribution becomes more visceral, and that is in itself a high risk factor in both men and women for many systemic diseases. So many negative things come together here. And insulin resistance also worsens. I'll be happy to link the studies for you, which are very, very conclusive. This means we must again note that several potentiating or multiplicative factors come together negatively in the system in a multifactorial way. It's all the more important to know these basic factors in principle without fear-mongering, and to know that there are very important, effective mechanisms to have a positive influence here. Seen this way, it's also logical that early onset menopause correlates positively with an increased mortality risk. So longevity starts here with a stable metabolic state, so that we can postpone this as much as possible or make it less dramatic. What often adds to the difficulty is that at the typical age of onset of menopause, which varies of course, let's say 45 to 60 roughly, typical dental issues naturally occur in dental life anyway. For example, the need for implants. And right here, it's important to know that unfortunately in this phase, bone metabolism is also influenced rather negatively by the hormonal changes taking place. Because estrogen actually inhibits osteoblast activity, with the drop in estrogen, bone resorption increases. The bottom line result is ultimately more of an osteopenia, meaning a thinning of bone, so rather less mineralization in the bone tissue. To put it simply, osteoporosis. And that leads not only to a higher risk of fracture and the resulting other problems of immobility and so on, but of course indirectly, not quite as sharply correlated, but naturally indirectly with a rather poorer bone quality for any necessary dental implants. Now that doesn't mean that osteoporosis in, say, the spine or the hip joint ultimately prevents an implant in the mouth, but of course certain systemic declines naturally also play a role in the jawbone as well. And that's why it's also important to counteract this positively through appropriate lifestyle, nutritional, and also supplementation factors. We know from studies, for example, by Comston and others, published in The Lancet in 2019, that bone loss in menopause within the first 5 years after menopause can drop by up to 10%. This is, of course, biologically relevant, for example, for the risk of fractures, but also the associated immobility or even mortality in old age. So a certain decline begins early, so to speak, and we can counteract that to a certain extent, not only with nutritional factors, but of course also with lifestyle factors like training, moderate strength training, movement, and sports in general. Estrogen also has a neuroprotective effect, so it influences to a certain extent the serotonin metabolism, the dopamine metabolism, synaptic plasticity, and hippocampal function. That's why there are sometimes negative manifestations of this in modern terms, brain fog and of course mood swings. It also has to do with other hormonal fluctuations, sleep disorders and many other things. Silent inflammations, these quiet inflammations, are a known disease factor or cofactor for the development of many chronic systemic diseases. This so-called low-grade inflammation also accelerates biological aging in general. And with the falling estrogen level, it now becomes even more difficult that the CRP, C-reactive protein, can also rise. Interleukin-6 as a pro-inflammatory marker increases. As mentioned before, visceral fat tissue increases, all factors that contribute to a pro-inflammatory metabolic state. And that also has to do with the overall metabolic state, so a slowed metabolism, poorer glucose utilization. Higher fat tissue is generally a factor here that contributes to more inflammation in the whole system, even without menopause. And in this phase, it is particularly important to pay attention to this because, of course, through menopause, ultimately through these metabolic connections, inflammaging is accelerated once again. And if we know that, we can, of course, do something about it to a certain extent. We have a certain window of opportunity for intervention. So knowledge enables an awareness that allows us to take appropriate measures to ultimately have better cards here. And a crucial card in this overall game is, of course, oral health as well. In other words, what does this mean for longevity? Menopause is, in a way, a biological tipping point, but it's also a strategic window that provides a certain amount of leverage. So, looking at the positives, strength training, for example, supports bone metabolism and insulin sensitivity, as do exercise and sports in general. In this context, we must, of course, ensure adequate protein intake. So roughly 1.2 to 1.5 grams per kilogram of body weight should be the target here. It's not that easy to achieve that. Supplementing omega-3 fatty acids is usually necessary because it's hard to get enough from a typical Western diet. Even farmed salmon contains nowhere near as many omega-3 fatty acids as its wild counterpart. Optimizing sleep is of huge importance. But also simple things like vitamin D status, so either enough healthy sun or proper supplementation, naturally with vitamin K2 in a certain ratio, and of course the important cofactor. Don't forget magnesium, because magnesium is extremely important for vitamin D metabolism itself, so you always have to think about all the key factors at the same time. And of course, inflammation management, where the oral cavity must be mentioned again, because relevant inflammatory processes happen here constantly, around the clock, 365 days a year. And you can contribute enormously by maintaining a healthy oral cavity, meaning periodontitis prevention and treatment, peri-implantitis prevention and treatment, and of course cavity prevention. And of course the appropriate regular home oral hygiene, which is ultimately in our own hands. With appropriate professional support, such as a dental hygienist or trained professional staff, this can help decisively. Regular professional teeth cleaning and the quality of dental restorations all play a role together. All these things are very important to keep the inflammatory load in the mouth and thus the systemic inflammation as low as possible. So menopause shouldn't be a biological decline. Menopause naturally brings some risks that should be managed as intelligently and carefully as possible so that you get through this transition period as unharmed as possible and with the best quality of life, because that ultimately can positively influence longevity and the quality of the coming decades of life. So longevity doesn't just start with banal, simple anti-aging creams, but it starts with endocrine competence and inflammation management. Yes, and biological holistic dentistry can really make a very valuable central contribution through the known mechanisms that play a role throughout life, because the oral cavity is extremely closely connected to the entire organism. The most important to mention is the start of the digestive tract. Control of the microbiome, the entire gut microbiome, all digestive functions themselves, a central component also in gut health, and thus also the gut-brain axis. And of course, via the networking, neuronal networks directly into the central nervous system via the neuronal inputs or also negative influences, via toxins in the negative case, via bacteria that can enter the entire system, and not just via the bloodstream, but also via the lymphatic system. And of course, also via retrograde axonal transport, toxins can also reach the CNS directly. And of course, not to forget, we should support brain health by avoiding or maximally reducing a tendency towards periodontitis. So avoiding pro-inflammatory conditions and event cascades in the oral cavity is a huge factor in dental life for overall systemic health. but especially also during menopause, because the described hormonal changes simply create a particular sensitivity here. And you just have to keep that in mind, because usually in this phase of life, corresponding negative factors are added, because simply through a certain accumulation of mostly typical dental pre-treatment histories that usually add up over years and decades here, also a typical mix of unfavorable conditions that occurs statistically very frequently in this age group simply presents a particular risk. And when we know all this, we can, together with professional help, and also with good know-how and expertise, contribute very, very much here so that a longevity is negatively influenced as little as possible. On the contrary, rather positively. And that quality of life is, of course, also simply correspondingly better, and the level of suffering is correspondingly lower. So menopause is a crucial phase of life for overall longevity, but also, of course, because of these converging, also coincidental simultaneities of certain probabilities. It is also a crucial window of time for oral health and thus also for quality of life. And here again, know-how and appropriate measures help quite decisively, perhaps even with only minor measures, to achieve a very, very large positive influence on the quality of life, and not just dental longevity, but also overall longevity. And that's why it's such an important topic, of course, in our Biolong Charity Doc Podcast, because it affects very, very many people. And young people often neglect many things during this youthful phase, of course. And later you realize that it might have been important to pay attention to one thing or another, especially dental and oral health. But the good thing is it's never too late. And with the right know-how and professional help, you can make a decisive contribution here to achieving maximum health and thus optimal longevity and joy of life. That's the purpose of this Longevity Doc podcast, and I'm glad you've tuned in and stopped by to watch, and that you're following this content. Please also check out the linked studies, because they show in black and white what's really behind all of this. In principle, I'm just explaining the connections in a simplified way, because ultimately it's not about individual study details, but rather about what this specifically means for you in your life. And how can you, in simple terms, maximize your overall health, overall longevity, and thus your overall well-being. Because only when you're healthy can you feel your best and achieve maximum quality of life and autonomy. We hope that we can make a valuable contribution with this. Please feel free to leave your comments and suggestions. Of course, nothing here is exhaustive. It's just meant to summarize the most essential points, translating the key take-home messages into simple measures that are easy to integrate into your daily life. On that note, here's to your best health and optimal hormones.